At the beginning of the pandemic, we had limited options for testing. We relied on PCR tests, which are considered the gold standard for tests. In the spring, the Centers for Disease Control and Prevention began accepting antigen-positive test results if they included what's called an epidemiologic link. That meant if you received a positive antigen test, you also had to have a known exposure to someone who was positive, or you must have had symptoms to be considered a probable case. And so what is done is these calls are made to find that out case by case. Since the spring, the Department of Health's epidemiologists have been working closely with local health departments to verify links for those antigen tests. Once the links were verified, those tests were included in our probable case counts. After understanding more about antigen tests, the CDC changed their definition in August. As a result, antigen tests, according to the CDC, could be included in case counts without additional verification. However, here in Ohio, we continue to manually verify those exposures and symptoms before counting these tests as positive. During the past 2 months, however, a couple of things have happened. Our cases, number one, have skyrocketed. We have many, many, many positive people throughout the state. We have been averaging 12,500 antigen tests per day, with more positive results from those tests, averaging about 700 positive per day on average, which means those 700 have to be verified. During the past 4 weeks, the volume of antigen tests has doubled, and the positive results, which need to be reviewed at the state and at the local level, have increased from approximately 332 per day to an average of 725 per day. Just as our hospitals are feeling the effects of this surge in cases, so are the Department of Health epidemiologists and the local health departments. These teams alerted us about 3 weeks ago that they were simply unable to keep up with the manual verification process for antigen tests because there's such a wide spread of the virus throughout the state of Ohio. As we've noted on our website, since then, we have thousands of antigen test reports pending. Today, I'm announcing that tomorrow, we will align with the CDC's current case definition. We'll begin reflecting those tests immediately in our daily reported case counts moving forward. We currently have 12,600 positive antigen tests in our pending queue. To address these cases in our pending queue, we will apply this updated case definition to positive antigen tests dating back to November 1, when these tests started increasing and when these cases began to accumulate. Tomorrow, we will clear those backlog antigen tests, and they will be added to our reported case counts. That will result in a one-day spike in reported cases tomorrow, and it obviously will be a very significant spike. These cases will be assigned then to their appropriate onset date, as all cases are. To be clear, all these backlog tests will not translate into new cases, not all of them. They'll be checked, and duplicate records will be removed. In other words, if two people with a similar name turns out not to be the same person, they will be clear. That will be, if it's showing up the same names and they verify it though on birth date that it's not that same person, that is cleared out. Additionally, we'll also be adding these test results to our positivity calculation in the coming weeks. That will not occur tomorrow, but that will be coming. As I mentioned, we have seen antigen test results become a bigger part of our overall picture of understanding COVID, and certainly a much bigger part of our testing. It's important to capture that in our positivity calculations as well. Just like we are doing with cases on our website, where you're able to look at probable and confirmed cases separately if you want to, we'll also be allowing you to toggle between PCR only, antigen only, and combined for positivity. So it will be reported. You'll be able to see that positivity however you want to see it in any one of those three groupings. We will be reporting the combined rate as our default, and that's what you will see number that we'll be talking about. But anyone can still look at the positivity rates by test types if you want to, and you want to see a more complete picture. Now, I think it's significant other Midwestern states, Illinois, Indiana, Michigan, and West Virginia are all combining antigen and PCR testing into one positivity rate, just as Ohio will do.